Good morning. I'd like to welcome Margot Levinson, who's agreed to come in today to talk about applying for the Masters in CBP here at Derby, and also more general the criteria required for completing the KSA and applying for Masters in general. So morning Margot, thanks for coming in.
Morning Wendy, thank you for asking me to explain this a bit, because I do know that potential applicants for the courses find this quite complicated, and we get quite a lot of phone calls and emails each year about it. So I'll start with just explaining the course structure a little bit. We have two masters. We have MSc in Cognitive Behavioural Psychotherapy for adults, and we have the MSc for Cognitive Behavioural Psychotherapy for children and adolescents. And they're very similar, the course structures are very similar, but they have very slightly different eligibility requirements. But for both of them, let's start with the similarities. The easiest route in requires that the applicant actually has what British Association of Cognitive and Behavioural Psychotherapies, BABCP, call a core profession. The core professions are clinical psychology, counselling psychology, educational psychology, forensic psychology and health psychology. You can be a mental health nurse, RMN, or psychiatric nursing, or a learning disability nurse. You can be trained in psychiatric medicine or general practice, like GP, family doctor, and the others that are currently counted are occupational therapy, counsellors who are already fully accredited with either the BACP, the COSCA, the CPC, the FDAP or the NCAC, social workers and probation officers, art therapists who are HPC registered, and teachers of special educational needs who have some sort of additional counselling or psychotherapy training. Now, this list of core professions has changed from time to time, and there are some indications in the future that actually BABCP might do away with it altogether. But currently the position is, if you do not count as a person who has a core professional qualification, then the route into the cases is by something called the KSA framework. KSA stands for Knowledge, Skills and Attitudes Framework, and you can find this on the BABCP website if you look under the accreditation tag.
I was just going to say, Margot, that given that things do change, I guess it would be the best route to make sure before you start any application that you check with BABCP to see what's currently happening.
Yes, it's important probably to do that, although whatever is the current list of core professions is always on the website under accreditation, but it has varied quite a lot over the years, and I say there are some indications that in the future, because it's got so complicated and because there is a certain degree of arbitrariness about what is on the list and what is not on the list. And certainly I have held a view, shared by some others, that it's very much biased in favour of adult workers anyway, and biased against children's workers, not really by design but by default. So it is always worth checking first. And people need to realise that if you do need to apply through this KSA, Knowledge, Skills and Attitudes framework, it's not in any way really a deficit position. You're just as likely to get onto the course through the KSA framework as you would be through the core professional framework. The process is very slightly longer, but not really very difficult. It sounds more daunting than it is, and in terms of how well the students achieve all their qualities as practitioners by the end of the training, as somebody who's taught on these courses for 5 years, I can't really tell the difference, and certainly it isn't my experience that people who have core professions necessarily do better or end up as better therapists and psychotherapists than people coming through KSA.
Right. I mean, I think that's really important to pinpoint, because I know I've had several people that have contacted me either by email or phone that are currently doing the advanced diploma in cognitive behavioural skills and studies, and they're getting quite panicky about the prospect of this huge, seemingly huge task of completing the KSA. So, you know, it's really important to underline that, isn't it? That, you know, it's not as horrendous as it might seem.
Now, it definitely sounds much more complicated than it is actually. The framework's fairly easy to complete. You need to be a bit organised, because there are some particular things that you have to get from other people, but it's not really very difficult at all, and it's not a big portfolio, the KSA. Actually, it's quite small. I think, however, that it might be better to kind of start at the beginning a bit more with the eligibility requirements and then come on to the details of the KSA.
Yeah, so if we go back to the eligibility...
So, the eligibility criteria, so you either have a core profession or you would have to come in through this KSA route. For the child and adolescent route, there's a little bit extra even for the KSA route, which is demonstrating that you have some knowledge of life stages and human development and the skills, and also an awareness of risk, for obvious reasons. Working with this client group are rather more vulnerable than adults. In all situations, you also need to either hold a degree or demonstrate that you can work at degree level. You don't necessarily have to have the degree itself. And so, for example, we've had lots of nurses who trained when the actual qualification for being a nurse was a diploma, and lots of social workers when actually the training for social workers was a diploma, not a degree. So as long as you can show you're capable, demonstrate you're capable of working at degree level, that's adequate. And then you also need some sort of relevant experience in health education or social care. Now, this can be quite confusing for applicants about what this actually means in terms of what is relevant experience. And the usual way I explain it, which sounds a bit blunt but probably is as near to the truth as I can make it, is that you need experience of working with people in health education or social care, where you were doing something that by its nature was therapeutic. Now, obviously it doesn't necessarily mean doing therapy, because most people aren't in a position to have done therapy before they were trained to do therapy. But it does mean more than, for instance, taking people around in your car to various visits they have to make either to debt counsellors or child agencies. It means more than just sitting down and having a cup of tea with somebody who's distressed. You actually have to be doing something that has some relationship to their psychological and emotional problems, and is support, but it's a bit broader than there, never mind, and a cup of tea support. It's a bit more focused, a bit more, if you like, almost clinical in nature. And if applicants have any doubts about this, it's always a good idea to phone up and tell us what you've been doing, and we can give you some advice about whether that actually fits the eligibility criteria. The sorts of things that people often have done that are relevant is people have sometimes worked as assistant psychologists. They've obviously got lots of experience. You may have people who've worked in the voluntary sector. They might have worked in women's refuges, they might have worked for Barnardo's, they might have worked for Childline, they might have worked as volunteers in some statutory agencies, they might have worked as teaching assistants, and you can see that most of these roles that people will have done are a bit more than just sympathy and a cup of tea. It's a bit more working with people who might be either distressed or might be quite upset in a different way. Might be a degree of conflict involved if you were working some sort of volunteer, maybe with one of the agencies that supports offenders. And you need really between the equivalent of a year to 2 years full-time experience of this sort of work. And what that means when we say equivalent is it means that if you added up all the time, it would be equivalent to somebody who had a full-time job, the amount of time they would have spent in that full-time job in a year or 2 years.
Mm-hmm.
You need to add up that amount of work, whether it's paid or voluntary, and add it together to make those figures up. Now, it doesn't all have to be for one person or one employer. So you could have done 6 months for Bernardo's and maybe 3 months for Women's Refuge, and then you might have had a gap and done 3 or 4 months for Childline, and then going back years you might have actually done some work as a teaching assistant and then taken some years off. So it's when you add it all together, it reaches this boundary of between a year and 2 years full-time equivalent. There's a little bit of flexibility on that, so again it is worth talking to us and not assuming either, well, I suppose you could assume that you meet the criteria if you're well over those numbers. If you're struggling to make up those hours, then it is worth perhaps seeking advice to check out whether what you've done does actually add up to the right amount of time. But you need to do some sort of calculation yourself on what a full-time worker would do in a year, and then do some sort of multiplier of that.
Yeah, so there's no sort of what could I say, criteria about when that was done. So you could sort of go back 6 years and say, well, at that time I was working as a teaching assistant, and then I left employment.
Yeah, there's not a historical test.
No.
Or I mean, I suppose if somebody had done something 30 years ago and they'd not done anything since, one might feel that their experience might be lacking in currency, because it probably would be. But people often come with things they've done quite a long time ago. So, for instance, we've had a lot of people whose background is teaching, sometimes in special education or pupil referral units or children with special educational needs, who've maybe done 5 years or more in this sort of setting, or in some sort of health supportive agency, and then maybe taken years out to have a family, or sometimes through illness in themselves or in their family, and actually taken years out and then come back. So no, that's not an issue in and of itself.
Okay, right, thank you. Okay, do you want to carry on with the entry requirements? Or
Yeah, we might as well try and finish those off. So we've done a relevant experience, and then if a student's first language is not English, this is usually for international students, they have to sit the IELTS test, which is a test for written and spoken English, and they have to score within band 7. Now this sounds quite high, and this is a relatively high requirement compared to some courses, but because psychotherapy is delivered predominantly using language and communication skills, it is fairly critical that students are able to talk reasonable English. And of course, because it's a master's course, it's expected that the work will be submitted at what is an acceptable standard for master's work in written form, and that means that English must be grammatical. Some students might need help with this, and it is our experience that even some home students, where their first language might not actually be English, have struggled with the requirement, particularly for good standard of grammar and punctuation in the written work. And with those students, we either advise they get study skills help from the Learning Centre, because they have quite a lot of leaflets and some short courses, and there's a few books we recommend that they can get that help people with basic English, like Lynn Truss's Eat, Shoots and Leaves. And there's also the possibility that we would suggest to some of these students that before they submit written work, they ask somebody they know who is a native English speaker and educated to degree standard to actually proofread their work. Students who experience processing problems like dyslexia can get more formal help from the university if the university accepts that they have a need, and will produce a support plan to help the student reach the required standard.